Hi, I'm Kaylee Starzik. I am a student at PNW Northwest in a child nutritionist class, and today I'm going to be presenting newly diagnosed type 1 diabetes in a child. So this is an incredibly important topic because type 1 diabetes impacts not just the child but everyone around them, considering people in school, their family, if they have a care team, any sports teams or anything like that. So pretty much a new diagnosis in a child, or really anybody with diabetes, can just feel really overwhelming. Like families and yourself have to learn how to manage insulin, monitor glucose, plan meals around this, and then just kind of recognize the symptoms for hypo and hyperglycemia, so highs and lows. And then, so my goal today is to help break this information down into clear, manageable pieces, so pretty much anyone caring for a child with type 1 diabetes can feel a little bit more confident in caring for them. So here today I have a couple of core objectives that by the end of the presentation you will hopefully know. So understanding what type 1 diabetes is and what causes what actually happens in the body. I'm also going to review the basics of insulin and blood glucose so that the management strategies make a little bit more sense to the person who's caring for that child. I also have learning essential nutrition concepts, including how to count carbohydrates. Recognize and just manage both hypoglycemia and hyperglycemia, like I stated before, as well as finally just applying any practical strategies for supporting a child at home, in school and sports teams, care teams, and even just during physical activities. So these skills are the foundation for successful diabetes management, or what I would assume, and think so based off the research that I did. So here I have what is type 1 diabetes. So type 1 diabetes is an autoimmune disorder. What that means is that the body's immune system mistakenly attacks the pancreatic beta cells. So this cell is basically responsible for producing insulin. So over time, these cells are just destroyed by the body. The pancreas is unable, or the pancreas is unable to produce enough insulin, or eventually any insulin at all. So insulin is obviously essential because it acts like the key that allows glucose to move from the bloodstream into the body's cells where it can be used for energy. So if insulin isn't present, glucose just kind of builds up in the bloodstream, leading to high blood sugar, and without treatment, that can cause serious complications. So a child with type 1 diabetes kind of depends on insulin every single day to survive like anybody else would. So most diagnosis occurs in childhood, which is why understanding early management and support is really important to this person or anyone around them. Here I have why nutrition matters. So now that we kind of understand what type 1 diabetes is in itself, I'm going to talk about why nutrition plays such a big role in this. So here I have that nutrition affects blood glucose directly. Carbohydrates especially have the biggest impact on high or low blood sugar levels. A child with type 1 diabetes still needs a balanced diet. They're growing. They kind of need everything. Their brains are developing. They need good nutrition that supports healthy physical development. But because food affects glucose so quickly, families need tools to predict and control those changes in the body. So the goal really isn't to restrict food. It's just kind of to monitor it. So children with type 1 diabetes can still enjoy food like pizzas, fruit, like snacks at school, but you kind of got to plan ahead of that. So nutrition helps prevent extreme highs and lows, and it helps keep the child's energy stable so that they can participate in school, sports, just kind of, everyday life and just living. So here I have carbohydrate counting. It is one of the most important nutrition tools in carbohydrate. It's just one of the most important nutrition tools. So carbohydrates are the nutrient that affects blood sugar the most. So carbs are found in foods like breads, pastas, rice, some fruit, milk, yogurt, snacks like crackers or granola bars, starchy vegetables like potatoes and corn. So when a child eats carbs, their blood sugar rises. So we kind of count the grams of carbohydrates in each meal or snack to match them with the correct amount of insulin that the body is going to need. Families can quickly get used to reading food labels, measuring portions, and using apps like MyFitnessPal or maybe Carb Manager to just kind of keep track of those, especially early on, using things like measuring cups, food scales, and portion guides to kind of help also manage that. Basically, as families learn more about carb counting, it becomes easier for the family and just the individual to take more initiative in what they're eating and their carbs. So here I have the plate method. The plate method is just to simplify meal planning, which I feel like most families would use just because it makes more sense. So here I have some values for vegetables, protein, grains, and there's just kind of some, like, just to monitor insulin and blood glucose and keep it stable. So the method usually divides the plate into portions like I have here that promote to keep it stable. So half of the plate is vegetables. This tends to be lower in carbs and higher in fiber, which is good. A quarter of the plate is lean protein, which helps keep the blood glucose stable and promotes fullness. The last quarter is whole grains, like I said down here, which is starches and stuff like that, which contain carbohydrates that will require insulin for coverage. So the plate method is just really helpful because it doesn't require measuring for every meal, but it does help. It also encourages balanced eating, which supports growth and steady glucose levels. So here I have some meal timing. So meal timing matters just as much as what the child eats and how much they're taking in. So children do their best with the predictable meal and snack times, just like anybody else would, because regular timing prevents large swings in blood sugar. Younger children may need snacks between meals just because their energy levels are higher relative to their body size. So this could really much just include small carbs and protein combinations. So you could do things like apple slices with peanut butter or cheese and crackers. Even whole grain crackers would probably be better for somebody with diabetes. Pairing carbohydrates with the protein and fat also helps slow the rise in blood sugar and preventing sudden spikes. Families learn pretty quickly which snack combinations works best for their child based off their blood sugar and how they act. So here I have hypoglycemia and DKA risks. One of the most important roles of diabetes care is knowing how to prevent and treat both low blood sugar and very high blood sugar. So hypoglycemia or low blood sugar can happen when a child takes too much insulin, eats too little food, or exercises more than usual. Symptoms normally include things like shakiness, sweating, irritability, dizziness, confusion. And then we also have hyperglycemia, which is high blood sugar, which may happen when a child eats more carbohydrates than expected, misses insulin, or just becomes sick in general. So if the blood glucose is over 300, parents or school staff should check for ketones. Ketones appear especially when the body doesn't have enough insulin to use glucose, so it starts to just break down fat instead. If they continue to rise, the child is risk for diabetic ketosis, or DKA, which is a medical emergency. So families just need to be trained to follow a child's healthcare plan, including correction for insulin doses, fluids, and then just kind of monitoring in general. So here I have some physical activity and glucose management. Physical activity plays a huge role in diabetes, but it also affects blood sugar levels. So exercise typically lowers blood sugar glucose because the muscle uses more energy. Before planned exercise, children might need extra carbohydrates to prevent a low. In some cases, their insulin doses may need to be adjusted depending on just the child or stuff like that. So different activities impact sugar differently. For example, running may drop blood sugar quickly, strength may cause delayed lows, and team sports might just vary depending on the intensity if they're playing something more intense, obviously. Even with these challenges, staying active is extremely beneficial. It supports bone and muscle development, heart health, and emotional well-being just in anybody, not just a child specifically. So here I have some school support. So school is where a child spends pretty much most of their day. So anybody being supportive in that school environment is essential to that child. Teachers and school nurses and staff should be able to recognize symptoms in children in both high and lows. They should also be able to allow the children to check their blood sugar whenever needed, before meals, before activities, or when the child just doesn't feel well. Normally that place is probably going to be the nurse's office. So fast-acting carbs like juice boxes or glucose tabs should always be available to the child, probably also in the nurse's office. Children should also be able to have access to water or bathroom breaks, as high blood sugar can cause increased thirst or urination in the body. So communication between parent and school staff is crucial. You kind of need to explain what's going on, and even have like a diabetes medical management plan or a 504 plan, ensuring that the child receives the combinations that they need. So here I have some practical tips. So some practical strategies just to help the families succeed with daily diabetics care. So like I stated before, using measuring cups, food labels, and apps to kind of learn to carb count early and keep track of that and just learn it a little bit faster. Planning meals and snacks ahead of time to reduce stress during busy school days, as well as keeping an emergency kit ready back at home, in the car, at school, which basically just will typically include glucose tabs, snacks, extra insulin, syringes, or pump supplies. You will also need to encourage independence as a child grows. So a young child might learn to recognize symptoms of the low, while an old child might begin to be counting their carbs on their own. So, and finally, you just need to stay in close contact with the child's diabetes care team, dietitians, and just doctors in general so that they can help you. Okay, here I have a summary. So for today's presentation, I went over type 1 diabetes. It's a lifelong condition, but with the right tools and education, it is very manageable. I went over insulation therapy, balanced nutrition, constant blood sugar monitoring to form the foundation of care in somebody in this with type 1 diabetes. Carbohydrate counting also helps family accurately match food intake with insulin, recognizing and treating highs and lows to quickly keep the child safe. I went over balanced meals, predictable routines, exercise, and just supporting stable blood glucose and healthy development, and supporting families, school, healthcare teams, just anybody who really plays a big role in the child's life to help them thrive, not just medically, but emotionally and socially, just to kind of help them. And then here I just have some references of the websites that I used to get this information from.